All right, guys. So this is episode 3, I believe, of the FITT podcast. So yeah, it's just me today. SK, I'll kind of address that situation right now. SK basically, he's got a lot going on. He's running his own PT business and everything. So it requires a lot of time that he doesn't have right now for the podcast. So it's not that he doesn't want to do it in the future, perhaps. It's just a matter of fact that right now he currently can't do it. So I'm just taking over for everything. So I kind of been the last month or two been game planning what I want to do, if I want to continue with the podcast, if I don't. But the problem is I already started it and I don't really want to go back on not doing it. I'm not a very big person on I start something and then I don't see through with it. So that's basically what we're doing. Now, what we're going to do is I'm going to be doing episodes here and there by myself. It's mainly going to be not just my opinion, but I'm going to be doing more research-based stuff when I do episodes and try to talk about that and my experiences as well, too. Um, but then I'm also going to have guest speakers come on. So the next episode, hopefully next week or the week after that, episode 4, I'm going to have a guest speaker come on. We'll kind of promote that. You guys can be informed about that, so you guys can look out for it when we post. But that's kind of where we're at right now. It's kind of been tough, a lot going on. So, yeah. So the podcast today is really talking about, my goal for today was really about recovery, um foam rolling, stretching, mobility work, recovery, not just if you're an athlete, but also just basic ability stretching, um that you can do for your body if you work 40 hours a week and then you come home and you walk and you're a little bit sore from that walk. What can you do? Or you're starting to develop some hip pain or back pain, things like that. What can you buy? What can you do to kind of get rid of that without having to go into your doctor, um, pay a copay, use your insurance, or just, you know, I'm not saying don't go into your PT, but if um my computer screen freezing up here, I don't know why, but I'm not saying don't. If I'm just simply saying if it's like a nonchalant, acute thing that's just happening there when you're walking, I'm going to go through some stuff and pop up some research articles, show you guys what I find, what I think, what research says about the specific things that we can give you as therapists and what's it really benefiting you to do, or benefiting you specifically. So I guess the thing that we're going to talk about is what exactly is, a lot of people complain, "Oh, when I stretch or when I'm wake up in the morning." Well, if you think about it, when you wake up in the morning, usually most of us sleep in certain positions for a long period. A lot of times people sleep on their stomach, which isn't good for a lot of reasons. But one, it distends the organs. Two, it puts your back in extreme more of a lumbar lordotic posture where you're more extended. It's just not comfortable for your body at all. Try it for 15, 20 minutes and you don't feel comfortable. Now that's if you're not injured or anything. Our hips can be tight, our ankles, our knees, everything is just stiff in the morning. What I try to do in terms of that is I tell my patients when exercises to do at home, do it in the morning. If you can do it in bed, do them in the morning before you get out of bed. That way you'll get kind of loose before you start on your bones, your muscles, loading your tendons, everything like that. That is what I usually have my patients do, is in the morning when you first wake up. I usually give my patients exercises that they can do in the bed for that specific reason, just so it's easier for them. And it's like, okay, I can be half asleep and maybe perhaps doing inside windshield wipers, as I call them, or knee to chest, or I don't know, it could be book openers, easy exercises like that. Could be quad sets, whatever it may be, ankle pumps. So that's why I prefer that. Now, your people are like, well, it hurts to move, it hurts to walk, stretch. I hate stretching when I'm so stiff. Well, think about this. If you leave something, I'll think about this metaphor. Say you leave, first thing that comes up in the mind is jelly. Let's say you making a PB&J sandwich, and basically you PB&J sandwich, you spill some jelly on your countertop, but you don't clean it up. Well, when you first spill it, it's nice and like loose and not hard. If you wake up the next morning after 8 hours, it's pretty hard. It's probably stuck to the countertop where you need some sort of cleaning material to get it off. That's kind of your body is. When we maintain, we're not meant to stay in one position the entire life. We're meant to move. Our body is meant to move. We have our body move. If you look at all the way back, cavemen, like they did not, rarely did they ever stay in one place for a prolonged period of time unless it was specific due to weather conditions, etc. They were always hunting, always on their feet, always moving. That is what our body is meant to do, which is why people talk about how movement is always good. It might not feel the best during it, but movement is always good for you. And also movement is good for you because there's so much research out there about the benefits for pulmonary system, cardiopulmonary, your heart, your lungs, your blood vessels. Let's see, what else? Your brain, and just your joints, preventing osteoporosis, decreased bone mineral density as you get older, all that stuff. But moving is so important. So, people are like, well, I complain about stretching a lot, and stretching is painful and hurts. Well, I would say this: stretching is definitely not comfortable. I would say that for even me, stretching is definitely not comfortable for me. It can't be comfortable for a lot of people. And it's painful sometimes. She's like, this really hurts, and I got to hold this for 20 or 30 seconds. That is what research shows us is what the stretching benefits is. 20 to 30 seconds gets those muscles to elongate and lengthen because they're in a shortened position. That's what happens. So muscles get really tight. They get in a shortened position. Okay. You want to elongate them just so they come to not super long where we start to tear anything, but just so they get to a normal resting position, and we have to elongate. It's like you want to equal and even. You don't want super tight. You don't want super long. You want right in the middle. And in order to get right in the middle, you kind of have to go a little bit further. That's how come that works. Now, anatomically, I'll explain this is basically your muscles contain sensory receptor cells that send signals to our brain. And through nerves and everything I'm not going to get into, but they're basically called muscle spindles. And when you stretch, special receptors or the muscle spindles basically send signals or neurons within the muscle to tell the central nervous system that this doesn't feel too comfortable, you're going too far, but we can tolerate this a little bit. It's basically telling your body like, okay, this is not comfortable, we're stretching this muscle, but don't go too much further than that because then it's going to get really painful and you have a possibility of straining or tearing the muscle. Not saying overstretching is a bad thing, but that's basically kind of how it works. The basic process is that and that's kind of what the initial reaction is, like initial painful feeling that people get when they attempt to stretch. It's also the reason why some people are in agony when they try to touch their toes. The quick pain is just very quick, and it sometimes makes people and patients not want to do anymore because usually pain is not comfortable. And how we move, we develop compensatory movement patterns, which is basically like we walk in certain ways, lift certain things, or bend down and lift certain things, or put our shoes on certain ways, or pants on, or clothes on certain ways that is least painful if we've had surgery or pain anywhere in our back, knee, hip, shoulder, neck, whatever it is. We develop movement patterns to eliminate that pain, which is not always a good thing for the most part. And that can lead to other things going on. But that's why stretching is stretching is not comfortable is because of that response. So I told you that a reaction response, and usually we try to avoid that. So it's like you're trying to train your brain. Good thing, this is not a bad thing. So that's one of the things. And I'd also say we do have different types of um there are different types of pain. I know many people are like, what does that mean? Like different types of pain? That makes no sense. Pain is pain, and pain is pain. Like if I'm in pain, I'm in pain. There is no way that there is a different type of pain or a different kind of pain. Like if my back hurts, my back hurts and I'm in pain. It's not necessarily true. So you got like four different types, and I'll help you basically have a first type that's called nociceptive pain. Um, and it's basically pain that is associated with like tissue injury or damage or even potential damage. This is basically when like on the nerves you have like sensory endings and basically like, attached to the muscles. And when those muscles get strained or tear or torn or have damage to them, those nerve signals and send that signal to that nerve. It's like this muscle is not firing good. It's hurt. It's not painful. And then those pain receptors kick in. That's kind of what that is. Nociceptive pain is basically due to tissue damage and an inflammatory response. And now this is a normal thing, though. You want this. I want to explain to you guys, whether it be athletes or my basic 8 to 5ers, my parents, my elderly, my grandparents, just a basic everyday person. You want to be able to feel pain. There is specific conditions out there that patients can't feel pain, and it's extremely dangerous because you don't know whether or not something is broken or if something's infected, and your pain receptors are just completely blocked. And those little sensory endings for the nerves are all blocked. So pain is a good thing. It's a part of the body's healing process. It's to communicate to us. And I want you guys it's kind of like a learning lesson. Like it's kind of like, okay, you get fired from a job, per se, and your boss sits down like, you messed this up. You got to change it. Okay. You go into the new job and you change that thing. It's like that. If you're having pain in a specific area, you have to be like, okay, I'm having pain during this. If let's say I'm on flights of stairs or something like that, and I have pain. Well, instead of doing stairs, maybe walk up a ramp instead, if that's an option, and then try to think about, okay, let me see what could be causing that knee pain going up the stairs. I want you guys to advocate for your own selves. That's the most important thing that I don't feel like this generation does, is we try to learn from others and get expert opinions from others when the research is out there for the internet just for us to read. That's why the internet was created, not for, yeah, for money. It's the main reason, but also because it's such a good information center. If you go and find don't use .coms or .nets, .orgs are good, .edu, research articles. Those are the best. But I know it's annoying, but you're on your phone 24/7. A lot of you are. Scrolling through TikTok or Instagram, what's to stop you from just simply typing in, why do I have pain going upstairs? Why do I have knee pain? And learn about it. Type in research after that. And articles will pop up, and it might give you some ideas of how to treat that. It's the thought process of, are we actually embracing our own difficulties that we have and trying to change those, or are we just okay with the pain and want an easy solution, and we ask our doctor and he gives us medication? That's not going to solve the root cause of the problem. It may for a little bit, but that problem is going to come back. It could be in a year, 2 years. It's going to come back and bite you in the butt. So that's what nociceptive pain is. Okay, so that it's inflammation, muscle damage pain. Then we got neuropathic pain. This is pain that is really associated with injury or disease of nerve tissue. This example would be like pain with sciatica. big term. You see my reaction when I say that's a very common term. I have sciatica. I have sciatica. Really, that's, you know, that term, I sometimes roll my eyes at a lot of patients, and I don't mean to say that rudely, but who say they have sciatica because doctors throw that term out. I mean, people who are not qualified and even know really what sciatica is throws that term out, and it's really something that may be an issue, but also may not be the issue. Neuropathic pain also can be radiculopathy, lumbar or cervical. Diabetic neuropathy, if you have diabetes and just lose sensation of your lower extremities, and shingles is another one. Trigeminal neuralgia. Not going to get into that. It's one of the cranial nerves, but just examples. This is type of pain that when you go into therapy or doctor's office, they will ask you, do you have a burning, shooting, stabbing, electric shock sensation down your legs or down your arms, into your butt, in your back? That's the questions that we usually would ask you, because that is what the signs and symptoms associated with neuropathic pain. And it can sometimes cause patients to be very hypersensitive to touch or movement, hot and cold pressure too. So it's very painful. It can be very painful. It can be almost unbearable sometimes for patients, but that's another type of pain that we associate with. Then you got nociceptive pain. It's different from nociceptive and neuropathic pain. It's sort of like, it's an umbrella term for basically chronic pain. It's usually basically like persistent pain that arises from a combination of possible a combination of neuropathic and nociceptive pain. So it's kind of a combination of both, but it's for a prolonged period of time, which is where we get chronic pain. This is basically where just our pain, it's basically we have increased sensitivity to different pain sensory pathways, which basically means that our body has become accustomed to us being in pain for such a long period of time that we think everything that we do is painful, and certain sensations and movement patterns and actions that we do is going to cause pain, and we already perceive the pain before we actually do that action. And that, I mean, realistically, I have treated patients a lot with these conditions where sometimes it's in their head, sometimes it's not. But the conditions like this where I have treated would be people like complex regional pain syndrome, type 1 or type 2. Type 1 is not with nerve-related issues, but type 2 is. Fibromyalgia, that's another one. That's, chronic low back pain. That's another one that's very common with these types of nociceptive pain. Those are very, very complicated conditions to treat for physical therapists and even doctors. There's treatments that we can do for it to really, really benefit patients, and hopefully kind of make it livable, because sometimes it's very hard for patients to be able to just live a normal life with those types of conditions. But nociceptive pain basically alters, like I said, our pain and sensory pathways in our peripheral and central nervous systems. Like I said, it sometimes encompasses pain with unexplained stereotypical pain forms, things that don't make sense that would causes pain. If you have these types of conditions or this type of pain. And chronic pain is not fun. It's not. I'd also say a lot of patients who are in chronic pain, I know athletes, me as a powerlifter, I've done this. I've created chronic pain for myself simply because of the fact that I myself did not listen to my body. I did not rest. I did not focus on what was causing my injury in the first place, what caused it, what can I do to fix it, what were the deficits that I found that would possibly cause my injury, and how do I treat those? And I just kept kind of, I'm just going to rest and not do it. It's going to get better. No, that's not kind of how it's going to work. powerlifting athletes. Different if you're, you know, a dad of two and married, or a grandparent or geriatric patients, everyday patients who are just trying to lose weight and you have pain, or an injury. It's much different mindset, really have to rest, recover, take care of your body, talk to someone, talk to your doctor. What can you do to prevent this from happening again? Why did this happen? Ask questions. That's what I always say. So, yes. And then I would also say the last one that we have is referred pain. And referred pain is basically where the pain that you're having is really caused from a different location in your body. Now, a lot of times this is deemed with visceral organs, oh, if I have lung and diaphragm pain, I would have pain in the throat and the back of the neck. If I had kidney pain, I would have pain in my low back. If I had liver and gallbladder pain, I would have pain in my right shoulder. Heart pain, pain in my left side of my arm, left side of my chest, things like that are very, that you would basically associate with referred pain. Now, referred pain can also mean that can also be more musculoskeletal as well. It doesn't necessarily mean you could be having low back pain, but is the low back pain directly from those low back muscles being super tight, or could it be because of how your glutes and hips are really tight on your right side? Your piriformis is tight. Your glute median mid are tight on that side. Perhaps because maybe you're putting more weight onto that right side because you have some left knee pain. And then what's happening is those glutes are getting tight on that one side and having to overwork. So because those glutes are getting tight and having to overwork and getting fatigued quicker, because you're putting all your weight onto your right side when you're walking and doing stairs or whatever, then what has to kind of work a little bit harder because the glutes are working so hard? Your low back. Everything can be tied to one another. So that's how referred pain kind of work. It doesn't necessarily mean, oh, I have ankle pain or my big toe is hurting and that's what's causing that. That is because I have low back pain. Or, it could be if it's neurological, like I said, if it's neuropathic pain, could be. I don't know. I'm not saying that, but I'm not saying that could be the case. But it doesn't mean necessarily, oh, well, I have neck pain and that's what's causing my hip pain. Very seldomly do we ever make ties to those two body parts. Not saying we don't as physical therapists or doctors, but usually if we do, it's a much more severe condition or diagnosis, whether it be musculoskeletal, neuro, cardiopulmonary, etc. So I know it's a lot of information for you guys to take. I'm gonna post a little bit of I'm going to post a little clip so at least you guys on pain and everything like that on the Instagram. Excuse me, don't forget to follow. I should forget to say that while we take a break here. Like, subscribe. Excuse me. I don't know, that's my protein shake. Like, subscribe, follow, and then follow the Instagram page. Really, we really appreciate that. I really appreciate that. But yeah, I'm trying to get this big, guys. I'm really trying to do this. I really want to just educate you guys on everything. So with that, okay, I want to start diving into, you got pain, stretching. We talked about stretching, talked about pain, different types of pain. I want to start talking about, what do you do? What else do you do if you feel stiff or tight? What can you get? What can you buy? So one of the things that many people are like, I was like, oh, I really want a foam roller. I want a lacrosse ball. I want a Theragun. I want this stuff. That can all be great if you use it properly. A Theragun is not meant to just go up and down your leg. going up and down your leg, going up, down your arm, going up and down your back. Like it's meant to do that. You should use it more for an assessment on your body. Um, assess where those tight spots are. You're going up and down your leg and you're like, oh crap, my hip flexor is really tight, but then my quad feels pretty good. Why would you spend time Theragun in your quad if it doesn't feel super tight? Work on your hip flexor. Don't just go up and down the muscles, especially if you're doing it as a warm-up for a workout or training or post-workout, post-training. Like specifically work on the muscles that at least you trained that day, you know. Really be specific and targeted with what you do. Spend your time wisely. That's what I'm trying to tell you is don't just work on a muscle. I mean, it's great. If the muscle feels great, why are you going to stretch it or do it? You know, necessarily it's kind of what we're talking about. You know, when patients come in with knee replacements, we don't treat the shoulder because the shoulder feels fine for the patient. That's not the problem. That's not their painful issue. That's not what's causing their pain or their deficits or limited mobility or function. That's one thing I'll say about the Theragun is be more specific when you use it. Two, foam rolling is great. It really is great. For me, I foam roll 30 minutes a day, if not more. Usually I foam roll 3 times a week for at least 30, 45 minutes on my off days, and then for at least 30 before I start any activity with my training. Lacrosse balls are great for your glutes. Hard to get at it for your low back. I think it's easy, but once you start getting into like against the wall and stuff, you know, is it beneficial? Some patients say yes. I'm not one to not say that. You can always put the ball in like a pillowcase and throw it over your shoulder. So I would say that is another one. Now I'm going to show you guys another one. Okay, give me 1 second. You're going to get a nice view of my room. Let me see if I can find it. Here it is. Here it is. Here it is. Here it is. Boom. Now, many of you might think this could be some sort of weapon. Okay, it's not a weapon. Do not hurt anybody if you get one of these. Okay, this is pretty thick, but I mean, you could, you know, if someone's just, I don't know, someone's trying to break in and rob you. Boom, boom, boom. You could. Okay, whatever. This is called a Theracane. Okay. Um, what you use this for? Dig into the back of your muscles. Okay. It's really what it's used for. Now, this is the same thing as a Theragun and foam rolling. Everything that you do, just because you feel like, oh, it's painful here, it might not be tight. It might not feel like, oh, this isn't really helping. Then you could try it for a minute or two and stop with the foam rolling, Theracane, the crossball, whatever it may be. You can stop. That doesn't necessarily mean that, sorry, a little bit stuffy, that it could be beneficial. But everything you have to do should be an assessment. Assess. Like if I have pain right here. Okay, let me kind of dig into that. I'm going to show you what I do. You're going to how to use the Theracane. It's so important how to use the Theracane. Let me put my camera down a little bit here. Okay. I am not going to go like this and just kind of go up. I'm not really working. Now, people might feel it if they push down, but a lot of times you're not necessarily, you're just kind of going over the superficial fibers of the muscle. To get in there into the muscle, you have to dig deeper. It will not feel comfortable. This is the same thing that I'm telling you with the different types of pain. There is such thing as good pain versus bad pain. Bad pain is when you have nociceptive, you have the nociceptive pain, you have the referred pain, nocioplastic pain, neuropathic pain. Those are all bad types of pain. There's good types of pain where, as I was saying, when you're stretching, for example, and all it's doing is it's basically sending the signals for the muscle spindles that this is uncomfortable. It's the same thing here. Like basically what we're doing is those muscles are super tight, so that's where your pain is at. And when you're pushing on them, they're like, no, I like where I'm at right now. Like I feel comfortable like this because your body is, you know, whether you're rounded shoulders like this or you have low back pain, your body has compensated towards that specific posture or way that you sit or squat or walk, and it's comfortable now. It might not be comfortable for you and your body. It's going to be painful, but it's like, I'm comfortable. I don't really want to move. I don't want to be pushed on. So that's where you have that pain. Once you start to kind of work through it and dig. Now, look at me. I am going up and down my back here. If I find a spot, this is assessing. You kind of go up and down. You're like, okay, it feels good here. But, oh, right there, that's a spot. Here's what you're going to do. Make sure you stand straight up. Good posture. Don't lean forward, okay? Stand straight up. And then you're going to kind of push down. See how my hands are kind of going down at like a 45-degree angle? You're going to push down and kind of go up and down your back. Up and down your back. Just like that. Now then you can even wiggle. You find that spot, that tight spot, you kind of wiggle back and forth. You kind of find that spot and you can kind of go up and down again. You know, basically, and then people ask me, well, how do I know if it's loose? It will feel hard if you find when you find that tight spot. When it is squishy or soft, that's when you know you've basically kind of released that tension in the muscle. Now, I'm not saying this is a great tool. Mine was $20. I give them out to patients all the time. Shout out Concentra. But I give them out to patients all the time. They're really beneficial. $20, like I said. I think it's great. It can easily, I mean, this one, I think I don't know. I think it comes apart. Not sure. Either way, that's another one. Now, I will say this. None of this stuff necessarily improves your mobility. Working with the Theracane, working on your muscles isn't going to improve your shoulder mobility, your scapular mobility, the two bones in the back of your shoulders here. Neither of those is going to necessarily lacrosse ball, foam roll are going to improve your mobility and how well you can, you know, walk or bend down and pick stuff up, or, you know, bend down and put your socks on. That's not going to necessarily improve it. It's going to help it because it's going to decrease the restrictions in the muscles and make them less tight and cause less pain. And pain is the biggest inhibitory factor that we have as humans, is we don't like to do something that causes us pain. It just is what it is. So it will decrease the restrictions of the muscles, but that doesn't necessarily mean that those restrictions aren't going to come back. If you go out, if you roll out for 30 minutes and then you go out and walk, that right hip's going to probably get tight again. You have to roll out again. So it's like every day you got to do this stuff. And that's why when we give exercises, home exercise programs to you, it says 5 to 7 days a week, because this is what you need to do to be able to get through that threshold, that pain threshold, because that's the first thing we want to do, is trying to get that pain down. If we can get that pain down with our patients, athletes, it kind of improves the ability. And then we get the buy-in, like, oh crap, my pain's gone. Now let me start to work on mobility and everything like that. And we sometimes try to do a combination of both, because you can't just get the pain down without moving. So moving just going to get us stiffer, get those muscles stiffer, and then it's going to be even more painful. But I'm going to pop up a research article here to show you guys just like the research behind whether or not foam rolling actually improves mobility, or what the benefits are from it necessarily. So give me a second here. Let me pop up this article here. I'm going to flip my share screen. Yes, I do. All right, so here we go. All right. A meta-analysis of the effects of foam rolling on performance and recovery. So it basically, this is what I'm talking about, is doing a research, going out, finding how does exactly foam rolling benefit me? Does it actually improve my mobility? How to do it, etc., etc. And going out and doing the research, taking accountability for yourself and your own body and your own health and well-being, and going out and doing the research. So you can kind of read through this. It's basically the abstract. I don't usually necessarily read the abstract unless I need a quick synopsis of an article. But for those of you who have not read research articles or don't often read them, it typically just talks about like what foam rolling is in the beginning, and then talks about if it's a lit review, which is what a meta-analysis stands for. It's just a bunch of research articles combined into one research article, most likely simple terms. Then it kind of goes through where they got their information from, and then it basically goes through the different results and criteria that they determined whether or not it was reliable or unreliable, and what the effects were on it. And then at the bottom here, it just kind of summarizes the results, saying overall it was determined that the effects of formalin and performance carbon are rather minor and negligible, but could be relevant in some cases to reduce, increase sprint performance and flexibility, or to reduce muscle pain sensation. Woo! There we go. This is exactly what I'm saying. This is gonna decrease the pain sensation in the glutes, but that doesn't necessarily mean it's going to fix the problem. It will make it feel better, but that doesn't mean you have better mobility because you rolled out your quads, your IT band, or your low back, or your hips, or your knee, or your calf muscle. Just because you rolled it out doesn't mean that it's more flexible, or you're at less risk of getting injured. No, it's not what that means. So, I kind of just go through the introduction, the results. It's very good to read this. How they set up the study exactly. But so here's one thing that I find very interesting in this article. Several potential physiological effects of foam rolling could explain the trend of improved sprint performance following pre-rolling. Inflexible bands of muscle containing knots, which is legitimate. Like sometimes you'll get giant knots. That's usually what we call trigger points. These are identified as inflexible bands of muscle containing knots resulting from muscle spasm. Barrier trigger points are typically painless and can result in muscle weakness, muscle fatigue, and muscle stiffness. Boom, 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 boom. This is what I was talking about with the referred pain, okay? And that you may have a specific trigger point in your piriformis, for example, and it could feel like your whole glute and your low back is on fire, because that's where those pain receptors refer that pain to. That could be an example. That's one thing. And then honestly, I kind of just read through the article. It's also really, really good for learning. But I would say this. Here's another one. Prolonged impairments in muscle function have been attributed to multifaceted process from central factors. However, it is assumed that subsequent fatigue after intensive exercise would account for 80% of impairments. Exactly, that I would agree with that. So it also says the physiological mechanisms of foam. They speculate that post-rolling might enhance post-exercise recovery of dynamic performance measures. These include increased levels of circulating neutrophils, which are basically like different types of cells in the blood, increased blood flow to the muscles, smaller increases in post-exercise plasma creatine kinase, which means basically after we exercise. This is exactly why when people say take creatine, what is exactly creatine? It's basically a compound that basically helps muscle recovery and improves performance. It actually helps your muscles recover quicker. So because when you work out, you actually tear your muscle fibers, so the quicker that you can get them to recover and rebuild. That's why we take creatine, is it increases the recovery time for the muscles to recover, come back to normal, rest, and be able to allow you to perform at a higher level the next day or the day after that, etc. So it also basically, as they were saying, increases plasma creatine kinase, basically allowing muscles to recover a little bit quicker, and activated mechanical sensory sensors that signal transcription, basically mitochondria, basically give us energy. This is getting really in depth, which is why I sometimes, if you don't understand that, I sometimes skip through it. But also, I would say, always read it. So basically, it talks about here. It says, in conclusion, This meta-analysis illustrates that pre-rolling seems to be an effective strategy for short-term improvements in flexibility without decreasing muscle performance. So short-term improvements, pre-rolling before they do anything. So short-term improvements is a very broad term in my opinion. And this isn't, and it says seems to be an effective strategy. This doesn't necessarily mean that it is the 100% guaranteed, research-backed, proven effective strategy to improve your performance if you foam roll prior. Not necessarily. There are a lot of people out there who feel like more dynamic warm-ups and foam rolling is pretty useless. So, yeah, here's another one that I find. The underlying mechanisms, however, remain elusive, and the effects are in part contradictory. While the effects of foam rolling and muscle function were less clear, the positive effects of alleviating muscle soreness with a larger body evidence endorse the utilization of post-rolling. I mean, after a workout, you roll out, eliminates possible muscle soreness or DOMS, delayed onset muscle soreness. And this is another thing that I think finding that. However, since the physiological mechanisms of the potential benefits of foam rolling are not fully understood, care should be taken by athletes and coaches, particularly when considering the potential harmful side effects are also suggested when foam roll is applied. Basically, what we're saying here is that there is little, and it says here, limited evidence should be considered prior to initiating foam rolling as a warm-up activity and or recovery tool. So they're saying there's not a lot of evidence saying that foam rolling can improve your muscle performance. It can possibly decrease your muscle soreness. But I would say it's more of a psychological barrier for us as it makes us feel less painful, less tight, and we then think that we have more mobility because of that. I will say this. Excuse me. Sorry. I will say this. If I do not foam roll, like today is my off day, I'm going to foam roll after this podcast. If I do not foam roll, I feel very, very, if I do not foam roll, I feel very, very tight. My mobility feels like crap. Everything feels bad. Now, does that mean possibly that I'm experiencing that as well too? No, but I would say foam rolling, I would say this. I do a lot of mobility, dynamic mobility, static mobility warm-ups before I do any lifts. And that is what I feel like benefits me the most. And that's what I've seen helps me the most get most prepared. Not necessarily just foam rolling prior to a workout or after a workout. So I just wanted to show you guys that. I know this episode I've been rambling on a lot. Not rambling on, but I'm trying to educate you guys. I'm just want you guys to see that all of these different tools, lacrosse ball, tennis ball, Theracane, foam rolling, all should be used as tools for assessing how tight your body is, where your restrictions are at in your body, where those muscles feel tight, where that pain is coming from. Roll it out, see what happens, or work on it, see what happens every day. That's what I try to recommend, 5 or 10 minutes at the minimum, at the max. If you can't do more than 5 minutes, okay. 5 minutes is better than nothing. 5 minutes is better than nothing. So if you can't do 10 or 30 minutes, that's fine. Not a big deal. But assess where the muscles are tight, where your impairments are at, and then roll it out specifically. Same thing with the Theragun. But also then, if you're still having issues, talk to somebody. Go see a doctor who could refer you to a therapist. Ask me. Ask someone, who is in the healthcare field. They might know someone who's in the healthcare field who's a PT or someone who could help you, or a doctor, to kind of help you figure out what's exactly causing the problem, your pain. If it's not been going away, if it's become chronic, or tester for anyone, what exactly was the chronic type of pain called? Anyone? Osteoplastic pain. Okay. So that's basically what I wanted this episode to be is educating you, excuse me, on basically the spectrum of one, taking accountability for yourself and your body, listening to your body, getting the materials, foam rollers, $15. Theracane is $20 on Amazon. I mean, you can go and get a tennis ball from a tennis court, someone hit it out and forgot about it. Roll on that. A baseball is another good one. Things like that. Then use the internet to your ability. Learn. Try to learn what could possibly be going on for you. Because a lot of patients, when they go into doctors, I hear this all the time, like, well, the doctors took 5 minutes with me or 2 minutes with me. I had no time. If you come into that appointment prepared and you talk about, and you're like, I did research on this and I have questions about this. Is this what could be going on? Well, I read this and this. That doctor's going to be like, oh, crap, this patient knows what they're talking about. And I don't mean to sound like rude because that's not how doctors think, but some of them do. And because they're so busy, they don't have an hour to spend with every patient. So if you come in prepared with a list of questions and articles printed out, and you're like, I feel like this is what could be going on. Could you look at this, or could we do it? Could we figure this out together? Or do you have any recommendations of who I could go see or who could help me? The doctor would be like, yeah, like immediately they'll be like, okay, this patient is bought. And sometimes it's hard for us as in the healthcare profession to treat patients who aren't bought into their own care, because it's taking accountability for what's actually going on with your own body. If something's going on with your body, I do this all the time. Like right now, I have left quad tendonitis, and like I rested on Wednesday. I didn't train, or Thursday. It's my deload week, but I rested because I was like, I rested on Thursday, and then I was like, I'm not training Friday, Saturday, and Sunday. I was like, what is training on Friday? I'm just pushing back the lifting day. Training back to back to back days is not going to make my pain any better. It's just going to prolong the inevitable of the pain becoming chronic issue. So an FUO is a lot better. And I've also been trying to figure out specifically what has been going on with my knee. Specifically, why am I getting quad tendonitis? Is it just because of overusage of my quad muscle and exercises that I do, like squatting and deadlifting, but also my accessories? Or is it maybe some hip instability and hip weakness on my left hip and left glutes? So what exactly be causing that? Ask questions. You can put questions in the comments below on the YouTube channel. DM me on the FITT Podcast Instagram page. Ask questions. I'm here. I'm always willing to help and give advice. And if reason be, I may, even give you some simple exercises that you could do at home, based off of, a questionnaire that I have that I give out to people once in a while about like what exactly is causing your pain, how long it's been going on, pain level, et cetera, et cetera. So, all right, that's it for today. I enjoyed talking to you guys. Please, like I said, please follow the Instagram page. Okay. I also started a new lifting page with all my training. Planning on competing on March 16th or April 12th. Gotta talk to my coach about that, confirmed, but I want to get that confirmed hopefully by today. So follow the Instagram page, the FITT Podcast, and then please subscribe, subscribe, comment below. Any activity on this is really great for me, so I really appreciate it, guys. Other than that, have a happy new. Oh no, it is 2024. Oops. 2024. First day of the year. Start out habits. Do not break the habit a weekend or 2 weeks in because you got other stuff going on. Take accountability for your own health and your own body, and realize that once you develop a routine, it's going to get easier and easier and easier, and you're not going to regret it. With that, have a happy New Year's Day. Take care, and we'll see you hopefully with our guest. We'll keep an eye out for that next week or the week after that.